Good afternoon, everyone, and welcome to this afternoon's or this morning's webinar, about California O&M licensure. At this time, I want to go over a few brief pieces of information about the webinar system we're using today. Right now, all of you are in listen-only mode. We recommend that you have headphones on, but if not, that's okay. If you need to use a telephone, there are pen instructions on your control panel. If you want to type in questions for us, there is a question box that you can use for that, and we'll be monitoring that. If you don't have access to a question box, you can email a question to Israel Martinez, israel@f64resources.com. At the end of the webinar, we have allotted about 15 minutes for questions. There is a raise hand option on your control panel that you can use. When you do that, we'll identify you, unmute your microphone, and you can ask your question. At this time, I would like to turn the presentation over to Israel Martinez.
Thanks, Ginger. So everybody, welcome to our little webinar on O&M licensure here in California. I just want to extend a big thank you to Matt and Ginger from AER, who without them this wouldn't be possible. They certainly helped out in trying to do all the logistics and everything possible to make this work for us. Matt also has served on the National Task Force working on licensure, so he'll be talking more about his role, and certainly was a big point of contact for us to reach out. Of course, CAOMS, this actually stemmed from a conversation our Southern California CAOMS chapter had on licensure and getting more information out there. And although it's a small group of attendees, this will be made available to everybody via recording later on, so everybody will be able to see it. So thank you to both CAOMS and AER for making this work. Ginger, next slide. Thanks. So again, I'm Israel Martinez. I'm with the Southern California chapter of CAOMS. With us today, we have Matt Hogel, who actually he's with the AER Task Force on Licensure. He's going to be talking about a little bit about his role. He helped us make all this work out for us, so thank you, Matt. Brenda, who's also with the Southern California chapter of CAOMS, and she, on previous years, has worked on some licensure efforts, so her expertise here is of course welcome. So thank you for Brenda for coming along, helping us out here. And Anthony Candela, who's at the Southern California chapter of AER, he is also his experience in working with legislature and at the state level, and working on the Guide Dog committee, or board, I guess, licensure board. His expertise will be very welcome here. And of course, Ginger for doing a lot of the legwork and the technical kind of background stuff. That doesn't go unnoticed. Ginger, thank you so much for making this all work out. And of course, special thanks to Dr. Grace Ambrose-Zakin, John Kelly, Nancy Miller, and Elga Jaffe, and of course, Brenda for being here and passing a lot of her wisdom along. So let's start at the beginning. Licensure, really, what is it? And paraphrasing Wikipedia, because of course Wikipedia, that's the source of all knowledge there. It really kind of has a decent definition, and meaning that it's a restriction of practice requiring a license. It's a permission to practice. And it's usually given in order to regulate some sort of activity that's either deemed a threat to a person or public, or it involves a high level of specialized skill. And the skill elements really kind of force the government to say, hey, you know, this isn't for everybody. Not everybody can do this, and we have to regulate the activity. And so whoever does this activity has to be licensed. And you can think of something as simple as driving a vehicle, you know, being that sort of specialized skill, or having demonstrating a specific amount of skill to do that. Or something as complex as being a medical doctor. You know, all those sorts of skill sets are very highly specialized, and as such, the government really forces a licensure requirement to anybody wanting to do those activities. Ginger, next slide. So we talk about licensure, but in our field we have a couple of different things going on. Our very first regulatory system we have is really called it's certification. And our governing body is the Academy on Certification of Vision Rehabilitation and Education Professionals, ACVRAP. So we're hoping to work through them to get our, CEU credits, and they are the people who nationally offer us our certification on that national basis. However, it's an optional choice, right? I get my certification because my employer requires it. However, I can find another employer that perhaps didn't have that mandate, and I wouldn't need that certification at that point. So really, the certification, while it's a national level sort of accreditation, it's an optional choice. It's up to you as the provider and the organization that you work for, whether that's a mandated thing. Other parts about a certification you got to think about is that it is a national board that sets the standards. So all these people come from across the country. No legal parameters. Like I said, it's kind of an optional thing. It's really organizational. The organization decides if this is something that we want to enforce. Uniform standards everywhere. Everybody has to do the same test. Everybody across the country has to perform a certain number of hours. Everybody across the country has to do a certain number of CEUs. So all those requirements are set forth. Initial testing is involved, of course, and ongoing continuing education. And grievances, if there are any issues with our clients, go through ACVRAP. So ACVRAP really is the sole governing body of that certification. Now, this is different from credentialing. And the reason we bring up credentialing is because here in California, we have the California Clinical or Rehabilitative Services Credential. And the governing body for that particular credential is the California Commission on Teacher Credentialing, the CTC. Of course, that only applies to our state. So only a handful of states have a credential, and it only applies to those wanting to teach O&M to school-age children. So it's actually required. You must have that credential in order to work with school-age children. So that is an actual requirement. You will not be able to work in a school at all if you don't have that. So another key difference, the California Commission on Teacher Credentialing sets the standards and approves those credentials. So we have a state commission that makes sure that everybody meets those requirements. They require at least 1 year of applicable graduate level coursework. So they have very specific requirements of what you have to have in order to have this credential. Grievances are handled at the state level by the CTC or the actual employing school district, because those, of course, comply with CTC. So it's a little bit different looking at those two. Licensure, on the other hand, is a little bit different in that you do have a state government board of professionals, but it's mixed in with consumers. So you'll have a little bit more kind of a whole stakeholder, all your stakeholders that are involved can be on that board of professionals that oversee the licensure body. And that, of course, is only done at the state level, just like credentialing. It's only going to affect the state that it's in. It must be, the person must have a license. It would be required in order to practice O&M within that state. So, for example, if we did have licensure pass, everybody would be required to have a license within the state to practice O&M, and that's including those who have credentials, including everybody. You're going to need a license to practice O&M. These people who are on the board of professionals and consumers and the stakeholders would be appointed by the government. That group would be the ones who set the standards and approve licensure for each individual. To practice O&M with any consumers, you must have a license. You're just going to have one. It's going to be a mandate at that point. And grievances would be handled by the governing board from the state. So it would be the State Department of Consumer Affairs that would be handling any grievances. And they, of course, would have the power to have somebody's license removed, or offer other sorts of alternatives for their license. So Tony's going to talk a little bit about the guide dog licensing. Tony?
Thank you, Israel. Hello, everybody. I have had the pleasure in the past of serving on a licensing board in California that I can describe to you briefly, and from that you get to see how a licensing board actually works. It is the California Guide Dogs Licensing Board, and that board, by virtue of laws passed and regulations written into the code, and again through the California State Department of Consumer Affairs, that board licenses both guide dog schools and also guide dog instructors. I may forget to say this later, but there's a cluster of guide dog instructors now who also have O&M degrees, and they get to do a little bit of extra work, as many guide dog schools are discovering that they can teach some basic O&M when their students arrive there. So it gets a little bit easier for the student to go to guide dog school, and if they need any O&M instruction, they'll just get it there before they proceed with their guide dog instruction. So that's why there's this extra layer of people who are instructors and O&Mers both at the same time. So the California Guide Dog Board has, under the Department of Consumer Affairs, an executive director, some clerical assistants, office space, a budget to perform the functions of the board, and a set of, if memory serves, about 10 people on the board, and they're all assigned to the board by the governor. The reason I got on the board was because I was the one statutory representative to the board. That's the head of the voc rehab unit in the state of California, gets to be on that board by virtue of law. That's what I was in a previous life. So I had the privilege of being there. And the board does many things. It goes around and inspects guide dog schools on an annual basis. It administers the examination to individuals who want to be licensed instructors in the state. It's two parts, by the way. There's a video of you performing your practice and also a written exam. There are background checks and other things like that you'd expect in a consumer protection type of mode that the instructors have to go through. The board also revises regulations when needed, deals with various stakeholder groups, everything from guide dog user consumer organizations to the professionals and the guide dog schools themselves. They regulate and collect licensing fees both from the schools and from the instructors when the instructors apply for their licensure. And these monies that are brought in via the fees are what fund the bulk of what it costs to run the board. So the board, in effect, is self-sustaining, minus the little bit of administrative support provided by the State Department of Consumer Affairs. So when I left the board about 5 years ago, just as an example, there was a request from Arizona where there was a guide dog school just over the border in Arizona where they felt that the practice of the care and treatment of the dogs was perhaps not up to standard. And because the school did a lot of fundraising in California, the California Guide Dog Board had a legitimate interest in how things were working at that Arizona school. And when I left 5 years ago, the then Attorney General, Jerry Brown, had authorized his staff to investigate the matter. And when I left, that's what was happening, and I don't know what happened after that. But there's an example of when something gets a bit serious, why a licensing board helps. Most of the time, the schools and the instructors maintain their license. They go through their daily working lives, and privileged by the state of California to work where they work and do what they do, and knowing that there's a checks and balances system and a support system around them. So that's a bit about what I saw with the guide dog board. We had to adjudicate disputes. We had to make sure that the consumer organizations who were worried about this or that were fully informed about things that were going on, and we took their input and we would make changes based on their input. So it was a very give and take thing, and it's very much a governmental thing. And the only thing left that's in my notes to say is all the law and the regulations. The original law was passed way back in the 1940s to protect people from fundraisers for guide dogs, even that far back, who turned out to be shysters. And believe it or not, that shysterism way back then is what caused the law to get passed, and it's embedded in the California Business and Professions Code, big giant code. And now I'm going to turn it back to Israel.
Thanks, Tony. So there's a lot of things that having a license as an O&M would do for us. It would definitely work at a state level to establish consistent standards and guidelines for our practice. You might have people operating differently because they've been at different schools, and even through ACV or AP, those guidelines might be a little bit broad. California license may require a little bit more uniformity in how we do things. It would ensure that qualified professionals are teaching O&M. A lot of times I hear complaints from O&Ms that TVIs are doing O&M and other things. It would enforce kind of at a more universal statewide level that only someone who has this O&M license can be allowed to practice orientation and mobility. We would actually get, in my mind, a little bit higher recognition and more equal footing in the medical field. I'm working with some OTs and PTs, and you know, because they reached out to us, but we really don't have any sort of direct work with the medical model unless you're working at a VA. Outside of the VA, we don't, as O&Ms, work within that medical model, and having licensure may allow us more of an avenue to get into that field, because there's a lot of people having strokes and diabetes, and access to the client, but also access to the professionals. So as we get into those arenas, those professionals will understand more of what we do and look at our services as something that is vital for their clients and patients. It might enhance our opportunity to obtain third-party reimbursement for our services. Medicare, Medi-Cal, that sort of thing, and insurance. And of course, that would additionally increase our services to our clients and patients and students, and provide them another means to pay for our services. Next slide. And to talk a little bit more about considerations, we have Matt Hogel. Thanks, Matt.
Thank you, Israel. Hello, everybody. So I'm going to be just giving you guys some general knowledge and considerations about licensure, and most of the information that I'm going to be talking about I'm bringing to you is coming from two specific activities. One, I've been the chair of and been working with the licensure task force for AER, and we've been researching this topic for a little while now, a couple years, and we developed a guide that answers some general questions about licensure. And I had Ginger send you guys this document this morning, so it should be in your email. And if it's not, just talk with her, and she'll get you a copy of that. And also, our task force had the opportunity to talk with AOTA, the Professional Association of OTs in the U.S., and their policy experts on licensure recently. And we were able to take away a lot of interesting points from that meeting. And so I'm going to share you some information about those two activities. One thing that we figured out is that the OTs in many states, they had registration or they had a credential registered with the state before obtaining licensure. So in the case of California, I think you guys and gals are maybe ahead of the game because most states in our field don't have an official credential like California does already. So it won't be so much of a leap forward for you guys in regards to being licensed. Also, it always helps to look at other fields like behavioral analysts, music art therapists, our OTs and PTs and see how and when they got licensed in your state, and also how they wrote their bills. Another point is you have to consider threshold questions when trying to make the case for licensure, such as will the licensure fees be covered by the professionals? Is the license itself going to protect the public? And can you identify the harm that would be caused in the event that there is no licensure to justify getting licensure for your field? So you need to think about those types of questions and have the answers ready as you guys are lobbying for this or as you're advocating for this type of activity. You also want to consider, in some states with low numbers, in California you might not need to worry about this, but if you're finding it difficult to get licensed independently with your own office, you can consider getting licensed through a licensing office that already exists. And some states already do that. Some states have one licensing office that they process the licenses of multiple different professions. So that's just something that's just a consideration. Another thing the OTs mentioned at the behavior analysts were a really good example to look at, because they were one of the first related services to get insurance reimbursement and licensing that in the history of the U.S. So they actually have a lot of good input from looking at that model. You also want to start by getting state legislators to know who you are and what you do. So when you guys plan your activities, like White Cane Day, or if your facility that you work at has kind of like an annual celebration or whatever, you want to reach out to your local representatives and invite them to these activities, and maybe invite them to speak. And if they themselves can't come, ask them if an aide can come and have that aide speak. The better you are able to develop a relationship between your elected officials at the state level, the better chance you're going to have to passing a bill on licensure for your field. Let's see where we're at. Now, you also want to include consumer groups in the advocacy. The OTs mentioned that the best advocates that they had were the consumer groups, and that many times once the idea of licensure got up and running and the consumer groups got really behind it, they mentioned that they, in many ways, became almost the leadership with getting it passed through the state legislators. Also, in many, if not all cases, the OTs, they had their registration or their national certification on a state-by-state level prior to achieving licensure. Now, you also want to make sure that you get data on, who's not getting services in your state and why. That's going to help you answer some of those questions I mentioned before, those threshold questions. You also want to find out who was the last group to obtain licensure in your state. That will probably give you a lot of ideas as to how long it might take and what that road looks like. And something that Israel mentioned already, but I'm just going to touch on it too. The OTs they said that getting licensure really is the first big step in getting your service recognized by Medicare or Medicaid and getting third-party reimbursement. They didn't say you have to do it that way or that it always means that you're going to get that reimbursement, but they said it is the biggest step towards getting that done. So that was just some points about the OT meeting and some of the information that we have in the licensure guide. You guys are going to have that from your emails. The politics are very complicated with licensure right now in the country. The United States, we all know that states are very reluctant to do anything, whether it's right or wrong, that's going to expand government and expand government activity or government control of anything. So, and that's what this is, really. So you have to know that getting into it. But there's a lot of ways that you can approach this that could minimize the shock value of, licensing another professional and having it registered with the government. And that's basically, you can identify, instead of having the state come up with its own exam, you can identify the need to use the national certification exam. That's one less thing that the state would have to fund. That's one less thing that the state would have to worry about. And it makes that license more portable, in the sense that if an O&Mer who's licensed in California wants to move to Florida, and the license in California is one of the requirements is passing that national certification exam, that is going to be a more portable move for that person to have their credentials in Florida as well. And that's one thing that the OTs brought up as well. Every OT licensure bill, or every OT license right now in the country, and they are licensed in every state at this point, they use the OT national certification exam for their licensure exam. So and they had, much like we have ACVREP, they had their own national certification body prior to making initiatives in licensure. So in many ways, we kind of are walking in their footsteps, which is good, because we could pull from their success and hopefully use that information to our advantage. A few other things that you could do politically, like I said, is if they're very reluctant as far as putting a lot of money into this, and they're worried about how much it's going to cost, make sure that you mention that the professionals' licensing costs are going to cover the costs of having the licensure board, and possibly considering using an already established licensing office as the home of your future license, your future professional license. Every state is different, of course, so you guys are obviously going to develop your own criteria as to who should be licensed and who shouldn't be, because this is basically what this does is this tells your state and the consumers in your state who has done what training and what education have they done, and does it count as a licensed professional or not. So you guys are going to get together and figure that out at some point. And when you do that, once again, that national certification is something you guys are going to consider. And as well the education component. What's great about California is, the credential that you guys already have already kind of points you in the direction you're going to go. So a lot of this stuff that's that could develop a lot of healthy debate, you guys have already figured out on a lot of levels. So once again, I think you guys are maybe a couple steps ahead in that regard. And just a couple final notes here. Licensure, we have to understand that it is a consumer protection. That's the whole point of it. It's to educate consumers about who has the training and education that's needed to be a professional in a field. And people get licensed in a lot of states for a lot of different reasons. Some people who are taking care of, who are doing pet care, or people that do manicures and stuff. A lot of these people are licensed, and it's unusual that our field isn't at this point. But it's exciting to see that groups in California, New York, and a lot of people on the phone today are getting involved in it. So it is a consumer protection. It educates the consumer as to who's licensed and who's not. And something that you all should take away from this is that consumers always, when they have the opportunity to decide, they always choose a licensed professional over a non-licensed professional. Sometimes they don't have that choice, but if you ask any consumer, would you want to go to a licensed doctor or a doctor who's not licensed, they're going to tell you they want to go to the licensed doctor. because to them it reassures them that this person has had the training and the education to provide those services. So that's one thing you got to take away from this as well, is that it is a consumer protection, but at the same time, it is very beneficial to the profession itself and to the workers in the profession. One thing I have here on the slide, the Licensing Occupations by Morris Kleiner. I really recommend that everyone reads this. It is not a large book, but it really gets into the benefits of having a licensed profession, not just for the consumer, but for the profession itself. And when you look and see how OT has grown in the last 20 years, they are everywhere. They're in school systems, they're in private practice, they're in hospitals, they're in federal programs, they're in state programs. They are able to exist in all of these environments because they have been very good about getting licensed. And I'm sure you would agree that there are a lot of places in our field where we should have people who are professionals or certified O&M specialists that aren't there. So that's one thing that licensure would definitely change. And that book explains in pretty good detail and with a lot of statistics what licensing professions does as a whole. And it's not a big read, so I definitely recommend that you guys take a look at that. Ginger, if you could move me to the next slide, please. Thanks. So just a few more resources to pull from. Here's also, in addition to Licensing Occupations by Kleiner, you could probably find it on Amazon for maybe $15. There's some websites here you guys should definitely take a look at. If you don't know already, the New York Vision and Rehab Association is the group that has been moving licensure forward in New York. You have their website there, and also their most recent version of their bill as of about a month ago. That link as well, and I think you guys will be able to pull a lot of information from both websites as well as the book. So, and also obviously feel free to refer to the guide that Ginger sent you guys this morning. And I'm just going to finish up with that, and thank you for giving me time to speak this morning, guys.
Okay. Well, it looks like I'm up. Welcome, everybody. Thanks for spending your Saturday morning with us. I was asked to talk about the history of licensure in California, or at least the history of our efforts towards licensure. And I have to start off with saying we didn't get very far, but I think it's important to kind of know where we were 20 years ago. I can't believe I'm old enough to say that, but so this is what sparked our initial interest in licensure was the 1992 AER conference, which was held in Los Angeles that year. And at the time, they had, Division 9 had a licensure interest group meeting. In fact, this interest group, I think, what they're now calling the task force, was in place since 1986. And what they were saying at the conference is that there seemed to be interest that was mounting from more and more states to move towards licensure. And at this meeting, they talked to us about what was going on in Tennessee and in Pennsylvania. So it was kind of interesting to find out that in 1989, Tennessee had introduced a bill to establish licensure. And their first shot at it had some snags, and it was initially rejected because of concerns relating to the appointment of board members, establishing appropriate fees for annual registration. They had concerns about delineating the scope of practice of O&M in the bill. And it turned out that the Tennessee Department of Health also began voicing opposition to the bill because it had a Medicaid reimbursement clause. So the Department of Health attached a fiscal note of $24.6 million. I don't know how they came up with this number, to address the cost of reimbursing O&M services in Tennessee. And that killed it right there, the first run of the bill. The local O&M group met with the director of the Department of Health Policy, and they designed their own fiscal note addressing the populations to be served, the hourly cost of O&M services, And they came up with a plan with a projected fiscal note of about $420,000 a year, for the cost of licensure and Medicaid reimbursement. So I know that Tennessee reintroduced that bill at least a couple of times. In 1993, Pennsylvania developed a bill to establish licensure, and they modeled it after the latest version of Tennessee's bill. And frankly, I don't know what happened at that point. I know they don't have licensure, so it would be worth perhaps finding out what happened to their bills at that time. The interesting thing was, at the time, the New York Lighthouse was working with the New York AER chapter, and they were drafting a proposal for licensure. And their proposal was looking at vision rehabilitation therapy at the time. So they were trying to establish licensure not only for O&M, but also for low vision therapists and rehabilitation therapists. And I'm sure Matt can update us more on the status of New York's licensure bill today. I know that Texas and Georgia were actively working toward a licensure bill back then, but I didn't keep up with the progress they made. AER was working on a third-party reimbursement initiative with healthcare reform, and they were really hoping that if that were approved, the next logical step would be licensure. So they weren't really working directly toward licensure at that point. But one of the big motivators for licensure is this whole avenue toward third-party reimbursement. And I think one of the things we need to look at is that at this time in the early 1990s, Oregon had already established third-party reimbursement through Medicaid. And this was specifically for O&M services provided to school-age kids who had an IEP that specified O&M services. So, which was really clever. They just bypassed the licensure avenue entirely. So they worked with an Oregon-based company called Health Choice Administration, and this company worked directly with the Department of Education, and the Department of Ed worked directly with Medicaid. So the clever thing about this is that they established Medicaid reimbursement for school-age kids. It did not extend to adults or anybody who didn't have an IEP. And the other thing that was really good about this is that a physician's prescription wasn't required. In order to get reimbursement, they just had to have IEPs with O&M goals. For requirements for billing, they said that the O&Ms had to be either state licensed or they had to be AER certified. Now, this was before we had certification through ACVREP. Back then we were certified through licensure. So, of course, they didn't have licensure, but the AER certification was sufficient, and all they had to do was use the membership number on their certificate in place of the license number. Also going on back then, I think it's worth taking note of, in 1994, there was a JVIB article titled Toward the Establishment of State Licensure for O&M Specialists, and it's kind of funny. I think that if you read that article now, it's as relevant today as it was 21 years ago. So if you can pull that up, I think it's definitely worth a look, because it talks about the history and what's happened. And honestly, I don't think the climate has changed all that much. So that was another thing that we were looking at the time. So we wanted to explore the interest in California to see, if California O&Ms were on board for licensure. And in 1994, at the CAOMS conference, I was on a panel addressing state licensure, and for the life of me, I cannot remember who else was on that panel. But I know I was there, and we talked about the rationale for licensure for O&M, and we talked about the differences between licensure and certification and credentialing, and we talked about the limitations of our profession without licensure, and we discussed what was happening in other states. And at this point, we were trying to probe the audience, who were O&M specialists, for their interest. And this is where we began to realize that we might have some obstacles within our own profession that we needed to address. Some of the things, concerns held by O&Ms is like, well, what's going to be involved You know, what do we have to do to become licensed? Why do I even need it? I've already got a credential. There were concerns about would I have to take a test, because you know, I didn't have to do this. All I had to do was graduate from the O&M program and apply for my credential, and I was good. And so there were concerns relating to a possible test that might be in place. There were concerns about possible annual cost, like what would it cost annual fees to be licensed. And then there was also the express concern, particularly by the O&Ms who work with school-age kids, is that they didn't really feel like they had a need for licensure because they held a state credential. So at the time, those that seemed highly interested in licensure seemed to be from rehabilitation careers, you know, those of us working with adults. And the others that were interested were those that were interested in pursuing third-party reimbursement through insurance companies and Medicaid and things like that. So that's where we stood from the 90s when we were looking at it. Dr. Fawzi had a brilliant idea. I think it was brilliant. She said, well, since the dog guide profession in California is already licensed, if O&Ms want to establish licensure, why don't we look at sort of tagging on to the existing licensure and see if we could get it to encompass O&M specialists? And I think it was a brilliant idea 20 years ago, and I still think we should look at it again today if this is something that we're going to seriously pursue. So Dr. Fawzi and I attended a couple of meetings with the California Dog Guide Board at their regional meetings. So I know we went to Riverside, and I forget what other city we went, and we were put on the agenda, and we talked about how, you know, as professionals in O&M, we're all serving the same population, and that we were interested in pursuing licensure. And I would say that we were very politely received, but the idea didn't take off. I think the Dog Guide Board was dealing with a lot of other issues at the time, and well, you know, they thought they were very warm and welcoming to us. It didn't take off at that point. So that's where we stood at the time. We attended a couple of meetings. We realized that it wasn't taking off at this point, and so Dr. Fawzi and I dropped our efforts at that point. So I think in summary, our concerns at the time, and again, this is 20 years ago, we weren't sure that we had a consensus among O&M professionals in California regarding the need for licensure. We recognized that there was some anxiety amongst the O&M professionals about what would be required. A lot of people were concerned about having to take a test and having to pay annual fees. And there were also some concerns that perhaps the consumer organizations in the field of blindness would not support licensure. So that's what we were looking at 20 years ago, and I'm not sure how much things have changed. It'll be interesting to find out. So with that said, I think I will pass on the next slide to Israel.
Thanks, Brenda. So and actually, Brenda, you touched on a lot of this. What we're going to need to do in order to pursue licensure here in California is we're going to have to educate everybody. I think the more of what we're doing today, just reaching out to O&M specialists, reaching out to consumer groups, reaching out to all stakeholders involved, our employers and organizations that we work for at all levels. Brenda, you spoke earlier about reaching out to people who already have that teaching credential and feel like, well, we have a teaching credential, we're okay. You know, that doesn't impact them in a certain way, reaching out to them as well. And creating that consensus amongst everybody that this is something that we really want to do, we really need to do as a profession to reach out to more people in a meaningful way. And develop an action plan. Once we have that consensus and know this is where we want to go, we got to start drawing that roadmap. You talked about working through the guide dog group or other ways. We got to figure that out as a profession. We got to create more materials just like this. Reach out and gather support from other agencies, AER, the Licensure Task Force. I believe Matt will talk more, or might be able to talk more about this, but is wrapping up or has wrapped up their efforts and creating their guide, obtaining support from our politicians. So that's going to require a lot of us to get involved to do that, to reach out statewide, drafting a bill, ensuring support from all stakeholders, fundraising for professional lobbyists. So a lot of this will take money, you know, how we get that money, how we reach out to these lobbyists and everybody. It's going to involve all of us in order to pursue this licensing effort. Next slide, Ginger. And talking about the political climate, Tony, because of his previous experience, probably has the most experience dealing directly with these politicians and actually license or bill-making efforts and running that through the state Senate. So, Tony, why don't you talk about the political climate?
Sure, I'll be brief because the discussion of the political climate can be an exhausting experience. The points that the others have made bear repeating. We are always looking for the best and most astute way to introduce a new element into the government service that does not scare the legislators or state government officials away. So the weaving of a professional licensure for blindness professionals into things that already exist is a really good start to how you think about strategizing for these things. You're always going to have, now and forevermore, the fear of expanding government, the worry about how much things are going to cost. So some of what Brenda and Matt have said about making sure that we have a realistic sense of the dollars, very, very important. We know others are also competing for funding, and so that makes it really important to make our statements and our claims be as strong and as compelling as possible. We may have people with different agendas, political agendas and professional agendas, some of which might be opposite of others. It's very important to know what everybody is thinking and get everybody talking together and work these things out. Very often what somebody thinks is a competing interest does not have to be, but it does require getting to yes, as another famous book once said. So you have to work the politics. Uniting the professional stakeholders, very important. Brenda mentioned before in past history, different parts of the blindness professional groups had different ideas, different worries, different concerns, sometimes based on where they work or where they hoped to work, and sometimes based on just having already done so much effort to become a professional that they didn't want another layer built in. And the question you always have to answer with regard to our professional stakeholders is, what's in it for me? So you have to be prepared when you're going forward with these kind of efforts to answer that question, followed immediately by, and what am I going to have to go through to get here, or to get there, to become licensed? Have to be able to answer that one. And the next one you have to be able to answer is, and what will life be like for me if I were to get licensed? And hopefully how much better off will I be? So that we can win the hearts and minds of our professional stakeholders. You have to do that, otherwise this thing does not fly. I do take to heart, and the fact that it is 20 years later may make it, with the experience we now have, a viable thing to go back to the existing licensing board here in California, the Guide Dog Licensing Board, and approach it, I think, because I've been on that board and I know what it's like to receive this kind of information when you're sitting there in open session on a board, approach it in a lot of different ways so that we can get a really full hearing from the Guide Dog Board, the legislative supporters, look at the regulations that govern that body, and see if there isn't a way to essentially append a professional licensure bill right onto their law, and see whether that can be worked out in a way that will be good for everybody and bad for nobody. So that is worth revisiting. I think the rest of this we've kind of already said. I believe California is a very, very good state to attempt to obtain licensure. in because of the structures that already exist, licensing board, the credentialing body, kind of a history in California, even though you hit these points of conservatism, a history of California of taking a chance on things. I'm a transplant to California, so I guess I appreciate this a little bit. Yeah, Californians are not shy violets. They try to do things. So this is in our culture, and I think the largeness of the state, the number of professionals in the state, the benefit to the rest of the country if California, along with New York, were to get licensure, kind of takes us a little bit outside of ourselves to what is the good for the rest of the country as well. It makes it worth our effort too, because we're not just helping ourselves, but we're perhaps helping others. That's a little bit of the political climate as well, what's happening around the rest of the country. Let me see here. I'm going to skip through. I think it's worth knowing. It's worth knowing that we're also attempting to do this right on the heels of the New York State effort. And the most recent effort, the most powerfully current effort, is the New York State effort to get a law passed. And they are tantalizingly close right now. I'm almost driven to say, let's look to our higher powers and pray for them, because they work so hard and they are so close. And they form the model, the modern present-day model, on all levels, for what they had to go through politically, all the different stakeholder groups they had to deal with, the writing of the law, the tweaking of the law, the dealing with different governmental entities within the state of New York that have interests in this law, et cetera, et cetera. To be so tantalizingly close and so current makes our climate here in California different than it was 20 years ago. Because of the New York experience. So another reason to kind of delineate our political climate in terms of what is happening today. So I think that's enough. We have a long adventure ahead of us as we move forward. We have the lessons of the past. Thank goodness for the Brenda Naimys of the world who do their best to recoup this for us. And then we have the lessons of the present, especially that's coming out of Matt's task force and also the New York State effort going on right now. That is what sets the stage for us and kind of frames our political climate as well. So thank you. I'm going to pass this back to Israel.
Thanks, Tony. So what we do now, I think we each have to work at our local levels. Decide if your CAOMS or AER chapter wishes to pursue licensure. Bring that up as a topic in your next meeting. Start a work group or a committee. Go to that meeting, and with that in mind, each of you can do a part and be active in that committee and take a role. Start probing your people you're working with. What do you think of licensure? Giving them some education, educating not just them, but stakeholders as well. Talk to your clients. Ask them, how do you feel about licensure? But I think we need to kind of organize all of these efforts, and I think the best way to start is through those CAOMS and AER groups. We also need to start creating support materials. Part of that education is here's something you could read on, here's a webinar you can attend, here's this meeting you can go to, and seek support from the profession and everybody. You've just heard from some great people here who've really been through a lot of the grind. I know Matt's been kind of nationally working on this for a little while. Tony.
Sorry, there appears to be a technical issue. Israel, we are unable to hear you. Israel?
Hello.
There you are. Okay, you're back.
Oh, okay. Okay. That was weird. Sorry about that. I don't know where I left off, but essentially, we need to work together. We need to work through our organizations. We need to educate everybody, our consumers, everybody involved, stakeholders, people we work for, and seek consensus on this issue. And of course, support from everybody that has been here and from one another as we move forward. What efforts are working? What challenges are we facing, so that we can face those and move on in this issue, if this is something we truly want to do. So now we're moving on to our Q&A session. Any questions? There is a couple ways to ask. The questions box on the right side on your GoToWebinar control panel near the bottom. You can type a question. This is type question here, I believe. Type that in right in that box, and please, of course, indicate who the question is for, and we can pass that along if anybody has any questions. And if you can't get to that box or have difficulty getting there, you can email me at israel@f64resources.com. So are there any questions?
And you certainly can also use your raise hand option on your control panel and let us know if you have any questions. At this time, I am not seeing any hands raised. There is a question, however.
From Sarah.
Okay. Would you read that for us, Brenda?
I don't see it.
Okay. The reason is
I see your hand.
There it is. Is our profession at risk of being extinct because of the lack of licensure? Good question.
I can speak to that only on a small part, and I think it's something that we need to make sure that our professionals working in schools know. And it's related to the fact that California is very unique in that we have an O&M specific credential. What's important to understand about credentials is that there has to be university preparation programs in existence in the state in order to hold a credential within that state. So we've got 2 O&M university programs in California. We got San Francisco State and Cal State LA. Both are headed by women who are probably thinking about retirement on a daily basis. If the universities are not 100% in support of maintaining those programs, they can go in the blink of an eye. If the O&M programs go, the credential goes. And that is something that has kind of haunted me for some time. You know, we faced a close extinction of the program about 10 years ago when California was in a terrible budget crisis. And we had a dean at the university who didn't know our program well. She thought, oh, you know, that's an awful lot of faculty just to teach 12 people a year. You know, you're very expensive. And so it was really frightening at the time. And of course, I'm concerned about my job, but from the big end, if our program goes, then it really puts our state credential at risk. So that's something that I think of. Now, that's certainly not a national issue, but I think licensure is probably best looked at state by state.
This is Tony Candela. If I can weigh in on a different angle, we've had a personnel shortage in the blindness professions for decades, and that personnel shortage really is not getting any better. And so you start adding in what are the different variables that are contributing to that personnel shortage. And one of them, and it's a big one, is money. So one of the kind of the ricochet effects of having licensure would be that it would enable more payers to purchase mobility services than currently exist. Right now, the huge amount of money that goes toward buying services that are provided by mobility professionals come from the school systems and the funding sources behind them, come from the vocational rehabilitation system, and come from the VA systems, to name 3 of the big ones. And yet there's an awful lot of service delivery that A, is not happening, and B, could happen if there were funding sources through the health insurance system. One of the hoped-for outcomes of licensure would be that there would be all this extra work out there. Now this circles around to the question: is the O&M profession in danger of extinction if you don't have licensure? The answer is it's possible that it's in danger of continued shrinkage. I realistically don't think extinction. That's a very extreme term, but just have the right combination of factors that happen, like what Brenda was saying about university programs closing, just brings you that much closer to extinction. The reverse, though, would be that if you had access to increased amounts of money and more diverse funding sources, the reverse would start to happen. The field would become more attractive to more people. There'd be more work to do than we have professionals to do, but now there would be money to pay for that. The university programs would probably find themselves expanding, and there'd be more of them. And instead of a shrinking field with shrinking dollars, we could have the reverse, an expanding field with expanding dollars to do work that currently needs to be done, that is not being done nearly to the extent it could be, if at all, sometimes. So the answer is complicated. I think the answer to the question is no, not extinction. The answer to the reverse of the question is the potential for great things for the field should we have a different business model than the one we have right now.
There's another question from Summer. It is, how much do we know about how the guide dog's licensure is structured? For example, how much are the fees, and what is their process for individuals to become licensed?
This is Tony again. I actually don't know the dollar numbers for what it costs individual professionals to get licensed. The guide dog school's fee structure is a different fee structure. It's actually outlined in regulation, certain percentage of the certain amount of money brought in by the school, et cetera, et cetera. The individual licensing fees I do not think are onerous. I have never heard a licensed guide dog instructor complain to me as a board member in the time I was on the board, could you guys please look into the licensing fee structure? I'll check with my colleagues and we'll get back to you with an answer with facts and figures on that, just because I think it's a great question.
Tony?
Yeah?
This is Israel. I'm looking at the current guide dog board application. It's $250.
Thank you. The process of getting licensed also is important. They have a rigorous process that involves, at least for first-time licensure, where they have to videotape themselves doing a wide variety of guide dog instructional tasks, as well as to take an exam and the background check, as aforementioned. Their structure is their structure. We think that the O&M licensure structure, especially if it can be tied in very closely to the academy certification structure, can be made a lot easier for currently certified professionals.
I have a couple questions from Jay Shupin. The first question is, how does licensure increase availability of O&M to the underserved? Anybody want to tackle that one?
A little bit of what I was saying before, this is Tony again, is that they, where there's less money and where there are other ways of dollars being spent to pay for O&M services, you start to get to the underserved, especially those who are poor or who are in resource-poor places in the state. And if, let's say, the Medicaid health insurance, or in California, the Medi-Cal health insurance system were to be involved as a third-party payer, you would find through the healthcare system and through the school systems ways of reaching both adults and children that perhaps are not being reached now. And also, if they are being reached now, they're being reached, but there's such a little bit of money to pay for them that maybe they can only get 10 lessons or 8 lessons, and so there'd be opportunity to give them more lessons. So it's unserved and underserved. the more dollars are available from different sources, the more you can start to cure that problem.
I have some oh, sorry.
Yeah, I was just going to have one person had a follow-up question to the guide dog licensure amount. Or
Ginger, can I just provide some input about the neglected services? I just want to piggyback
Sure.
on Tony real quick. So, as I understand the situation in New York, and it's one of the larger reasons why they're advocating for licensure right now, is in this New York system. However they're doing billing, and I'll be honest with you, I don't know exactly how they're doing billing in New York in the school systems, but they are TVIs, as certified teacher visually impaired. You're able to bill, and as an O&M specialist who has an ACVREP or an NOMC or MS and O&M, you are unable to bill. So what has been going on for a long time is a lot of people who are providing the services, the O&M services, are actually TVIs. Some of them do have their O&M credential, but many of them don't. Also, you see a lot in that scenario, you see a lot of OTs who are also providing some services. So what's going on really is, as they were the New York group was able to identify two scenarios. One, you have groups of people who are providing services that probably don't have the amount of training they need to do those services, but also they realize that people aren't getting evaluated properly to identify whether or not they do need or don't need O&M services, because that is also a large part of the training, is understanding how to do that well. And so that's just the New York circumstance. I've heard of a lot of other circumstances across the country where, people, it was implied or it looked like people probably weren't getting served or services based on that type of situation or one similar to it. So with licensure being passed, it's going to guarantee the consumer that they are getting a proper evaluation. They are going to properly be identified as needing services or not needing services, and that they will get the services provided by somebody who has the proper training and education. And what was the second thing? And with third-party reimbursement, like I said before, licensure doesn't automatically give you that. There's another giant loop to jump through in regards of getting third-party reimbursement, but having a licensed profession is a huge step towards that, because it's very unlikely and almost unheard of for a state to or the federal government to provide reimbursement for a non-licensed profession in the medical field. And so and if you look on the New York website that's on the slide that I have, there's one of the first things you'll see on that website is that they've estimated that 3% of all adults with visual impairments, it was a recent study that came out, said that they are not getting the services, the rehab services they need based on this situation and the other one I talked about. So I think there's a lot of information out there about how people aren't getting services and how licensure can assist with that. Thank you. I just wanted to add a little tidbit.
Thanks, Matt. One of the follow-up questions was regarding the annual fee for the guide dog license. Israel, Tony, you may be able to answer this. Is it $250 a year, or once you get started, or how often? And what would it look like for keeping up licensure?
Tony, what is the frequency? I'm looking directly at the application and it indicates $250 application. But how long does that license last, Tony?
Do not know. Don't recall. We'll have to find out. But it's available in Israel. You'll probably find it because I know how fast you work with a computer. So we'll shortly get the answer. If not now, we'll send it out to the group.
Another question is, can you touch on the process for getting the Medicare laws changed to include O&M if licensure occurred?
I'll start, and then as others catch catch up to the thought processes, please jump in. We know that these things are not easy, and Matt is right to remind us that any of the third-party reimbursement ideas that we are talking about are a next step after establishment of licensure. So you would have to work through, as the question asks, what type of process, a legislative process, a regulatory process. You'd be adding a profession in that was not covered, and they would now be covered. There was a Medicare demonstration project that was funded years and years ago, where they attempted to see what would it be like just to have a O&M prescribable by a doctor using a health insurance reimbursement process. So I'm sure some of the good and some of the bad and some of the ugly from that will get weighed into the testimony. Most likely, it would be up to some legislative analysts at one level, and also some government experts, especially health insurance experts, to actually answer the question. I really don't know at this point what it would take, a law being passed or a regulatory change. I don't really know.
We have quite a number of other questions. One of them is, where is California right now in moving forward on this project? As in, is there a committee or group unified effort toward working on this, or is it separate scattered interest groups?
Currently, there are not separate scattered interest groups because the only group that's expressed interest so far in our young attempts at moving this forward in California has been CAOMS and AER, those two groups. I think the next step, and it's hard to know who's on this call now, in California, the next step will make sure that the Northern California CAOMS and the Southern California CAOMS are equally involved and equally enthusiastic. And that's as far as I am aware the effort is as of right now here in California. Very new.
Another question is, as many O&Mers are duly certified, such as TVI, has there been thought in bonding together with other blind rehab fields? Could we have one licensing body that oversees licenses for more than one blind rehab specialty?
The answer is yes. As a matter of fact, in New York, I believe they're targeting both CDRTs and also the rehab teachers and also O&Mers. So based on how our politics go, both our stakeholder politics and our legislative politics and every other politics, we can choose to encompass into a licensing bill in California more than one blindness profession. The logical thing to do right now, though, would be at least to go no further, in my mind, right this minute, than the three that are Academy certified. So that would be the rehab teachers, the O&Mers, and the low vision therapists, because then you can piggyback on the power of the certification exam and the certification body in pushing our effort forward. As they get more professions certified over there at the Academy, they can be pulled in as well. That's my off the cuff answer is yes, we can bring more than one profession in, and B, I would probably strategically say let's go with the certified ones just for now.
As a follow-up to that, Summer says, I know of many experienced O&Mers who are not ACV REP certified. How do we get them on board if the ACV REP certification is a part of the requirements? Not that I'm saying that ACV REP certification is a bad idea. I suspect there might be quite a bit of pushback against licensure from these O&Mers.
Summer, that was the concern that we were facing 20 years ago. So I think that any task force that is seriously interested in pursuing licensure in California, that's got to be the first question that we develop a powerful answer to.
Another question is, if the O&M university programs in California are removed, will the existing O&M credential held by O&M still be valid?
I couldn't say. My guess would be that it would no longer exist. My second best guess would be that if O&M's training were going to continue, it would be an add-on to the education specialists for teachers of the visually impaired, which is how it stands in the majority of states.
There's another one that says, would we also fall under the Business and Professions Code like guide dogs? And as a follow-up, how would currently credentialed O&M professionals be transitioned to a license if it were passed? Grandfathering?
I think the answer would be yes, it would fold into the Business and Professions Code, but it's hard to know until we start diving in. I know in New York they deal an awful lot with their education code and the governmental bodies that oversee the educational system in New York. So we'd have to get with a legislative analyst and a lobbyist and those folks to actually look at the structure, because you'd want to know very soon on just exactly which way to tackle the issue of getting this into law and into regulation. So I'm going to say for right now, only because this is all I know, is it looks like it would go under the Business and Professions Code. Reason being is that all these other professions that are licensed are also there too. Psychology, medicine, cosmetology. I was at a meeting where the Boxing Association was there. They're licensed as well. And so given the wide variety of professions encompassed under Business and Professions Code, Department of Consumer Affairs, and the licensing boards, more than likely this would follow suit.
Thanks, Tony. Matt has some information to share on the costs of OT licensing. Matt?
Thanks, Ginger. Yeah, just people were talking about the costs of it and all, and how it might change. So when an OT pays for to become licensed, let's just say New York, the licensing costs are $294. And that's every 3 years. I think that's the initial cost, and to renew it is maybe just a little bit less than that. I think it's $200. But in addition to that cost, they have to pay for the national exam, which I think had a cost of around $300 or $350. So it's pretty comparable to what you would initially. Those two things combined is pretty comparable to what you initially would pay for your ACVREP certification, and then after that initial cost, the cost to renew it is about equal to or similar to what we're paying every 3 years or 5 years, I can't remember, but with ACVREP. The big change, I think, is if things move forward, is going to be with ACVREP, because if most of us in a state that accepts license, or has a license for our profession, we might not need to be certified with a national certification body, but we would still need that test if the state identifies that test as the one that they would hope for the license. So, but the whole hope with that tricky situation is that licensure would increase the numbers of professionals and increase the numbers that we have, so they might not, they'll be charging hopefully the same but charging a larger group. Hope I wasn't too vague on that.
Thanks, Matt. We have one last question from Dana. She says, has a survey of all O&Ms with CTC credentials been recently conducted to get current widespread feeling amongst California professions on this topic?
Not at this time, Dana. We are at the very earliest stages of even talking about licensure.
Okay. We have one other.
I have a couple. Or Ginger, do you want to take that?
Yeah, I'm going to unmute you, Kara, so you can ask your question. Kara?
Hello, this is Kara Snack. I'm the current president for Northern CAOMS, and I will be presenting, not in the nutshell, what we've been discussing here today at our next meeting, which is actually next Saturday. And I was just wondering if we have established who a main contact person is within CAOMS. Maybe that's you, Israel, and then also are you looking for, in terms of unification for Northern CAMS and Southern CAMS, are we looking to have some representatives from Northern CAMS? I'm sure the answer is yes, but about how many people perhaps would you be looking for to join up and be able to meet more regularly to discuss this issue should we move forward with it?
That's a great question. Sure. The reason, this little story, I posed this question to the Southern California chapter of CAOMS, and I think we came to the consensus that that we needed more information as well, and it started from Dr. Grace Ambrose-Aiken, who attended our CAOMS conference last November. I'm just starting out, and I'm curious too, so I would be more than happy to kind of get things rolling here. If you can get, a smaller group of, 3 or 4 individuals to kind of communicate with. I'll have to do the same here, because here it's just been me. I've been kind of coordinating, luckily, with these awesome people who have this experience and knowledge, and they were nice enough to come in on a Saturday to do this. But on the CAM side, it's just kind of me right now. But I would like some help too, because this is a huge effort, and if we could at least get the ball rolling between the two of us, and of course AER, Northern California. And one point that we didn't really touch on that we might want to have a discussion about is also, is this just about mobility? And I know the New York effort has been including CVRTs and CVLTs to an extent. How can we include them? Do we want to include them? That's maybe a discussion that we need to have as part of our groups as well. So you can contact me, Kara, absolutely.
Thank you.
At this time, I don't see any other.
I have a couple more. Is that okay?
Sure,
do you have time?
Sure, go right ahead.
Okay. Jay asked a couple more questions, and the first one is, what efforts have been made to reach out to the NFB on this issue, and what were the results? And I can just tell you what I've heard from Dr. Grace Ambrose-Aiken at Hunter College. I believe she stated, and Tony, you can remind me, that they had reached out to NFB, and they essentially said that they had no comment. They're not taking a stance on it, but they're kind of allowing the legislature to go through. Is that correct, Tony?
That part's correct. There's been a few parties out there who have agreed not to oppose, even though they might have wanted to. But they were talked into neutrality, as it were. The other thing that with the NFB that I think was a very winning point that the New Yorkers did was they allowed the NFB certification to carry the same weight in their scheme as the Academy certification. This I think went a long ways toward reducing what in some states can be a more powerful force than in other states. It goes state by state. If they were to oppose, they do have a good political clout. So. What you get from this is a couple things. One, some very not so bad compromises to be made, really, and the need to give and take. So we haven't yet, of course, in California because we're so brand new to the process, but they did go through a long and very, very good communication with the NFB back in New York.
Great. And there's one more question. I'm sorry. Did anybody else have any input on that NFB comment? One more question from Jay, and the concern was about third-party reimbursement and the very strict standards that will be set for service that could limit services to students with severe cognitive disabilities who tend to make very slow progress. I see this in OT and PT. How do we avoid these pitfalls? Anybody want to tackle that one? Basically, I believe there's generally restrictions on how many hours are covered through that insurance model. And obviously, there's students who do need additional hours. So what sort of things can we do to prevent that?
Oh, go ahead. Sorry.
Okay, this is Matt. I just my impression of what I would see unfold in this scenario is we've already established in this country that O&M is a service that's provided it's an educational model in K through 12, and even actually a little bit earlier than that, a little bit after that. So I don't think that process is going to switch over to a medical model, which has been traditionally the OTPT kind of process of applying services for that age group. I think that our O&M services and the school systems are going to continue to be educational services and instructional services, and I think this is just going to add another track of services, and I don't think it's going to change what we already have established into being only a medical model. I think it's going to be, we're still going to have the educational model, and we're still going to have what we have in the VA system and the state rehab agencies, but I think it's going to add a little more diversity in options with what having licensure or third-party reimbursement might bring to the table for people needing O&M services. And that's just my take on it.
Israel, we have time for one final question, and I'm going to summarize what it is. It's from Dana, basically saying, what's the next step to you're going to have two CAOMS branches create a committee, or basically what is going to happen next?
That's a great question. I think that's what's going to happen. We're going to have to communicate closely. We're going to have to work together on this effort. This is not simply a Southern California issue or Northern California issue. It will touch everybody, including our stakeholders. So at the very least, not just within CAOMS, but also AER, maybe including other professions if that's something we decide that we want to go down, that road we want to go down. Absolutely, yeah. So I think if you want to do something right now, it starts next weekend when you go to your CAOMS meeting and you bring it up as a topic, decide on just, a couple people that you want to kind of help focus on, and then we'll get together that way. That's really kind of today what you can do is bring that up as a topic if you want to move forward and get involved. Raise your hand when they ask, do you want to do this? Get involved.
This is Tony. I'll toss in a few other things too. We're starting to develop a body of speakers. We're mixing and matching. Today we have Israel and myself and Matt and Ginger and Brenda, but we have some friends back in New York who also have spoken to us before and were willing to be on calls. So as these conversations starting next week with Northern California CAOMS. We can help out because we've now spoken a few times and we keep gathering information and we keep learning. Every time we talk, we learn more, not only about what we don't know, but what we still need to do going forward. I think some other things that have to start now. I've been in touch with New York for a number of different reasons. One of them is to make sure that we understand how they gathered all the different interest groups, the private agencies for the blind, the consumer organizations, and et cetera, et cetera. How they gathered them together, how they communicated, how they worked together, how they compromised, et cetera, and what would be the parallels to that in California. So that's another action that has to happen, has to be in our game plan sooner than later. So we have to do that. Very soon we're going to have to start looking at where we're going to get the money to buy lobbying services and legislative analysis services and all those things, because none of this is going to happen without that. So we're going to have to start looking for money soon. I think getting the private sector together, especially the agencies for the blind, is going to go a long ways toward that, because some of them have a few dollars perhaps they can help us with, but we're going to have to convince their agency directors to buy into this. So there's just a few other things that are in the game plan, and we do have guidance from New York and the steps that they have taken along the way, and people to help us to make sure we do those things in the most efficient manner possible.
Great. We have 1 minute left. So Israel, do you want to wrap it up?
Sure. I just want to thank everybody for coming. I know that it's a Saturday and people would rather be doing other things sometimes, but just the fact that you took the time to listen on an important topic And hopefully this is the start of a movement that we see is important for our professions, and more than anything, important for our clients. Get involved with your local CAOMS chapter, get involved with your local AER chapter, get involved if this is something that you believe we need to do. But I think we need to work organizationally within those organizations to draft a nice, solid way of getting out there, educating people, and moving forward on this topic. So bring it up at your next meeting. If this is something that you feel passionate about, we'd be more than happy to take you in and have you help along the way. Special thanks again to Ginger, who did a lot of the legwork getting the webinar going, Matt for a lot of his guidance from the national level, working with the AOTA, Brenda, who just has a lot of knowledge and history, and thank you for doing this kind of last minute, Brenda. I appreciate that. And Tony for your knowledge here in California. So I appreciate all of you for taking part of your Saturday to be here with us.
Thanks, Israel. I do want to tell everybody that we will be posting this presentation. We're recording it right now, and we will be posting it on the AER website and sharing it with the CAOMS group as well. Someone also asked about the PowerPoint. We will be adding that to our site as well, so it will be available.